Okay. Can you please describe what you see in this video?
I can see I can see a child who is his arm is shown only, and he is having a target lesion, which is a bullseye lesion, having surrounding erythema and central erythema as well.
Yes. So, what is your diagnosis?
This is erythema. This is the rash of erythema multiforme, and the most likely diagnosis is Steven Johnson syndrome or other causes like drug induced and other causes are as well.
Okay. So in this video, I can see a child hand is showing specially. There is, we are not seeing that child face, that how he's look like average or not, device attached or not. We are watching that only. There is a lesions on the hand that is look like bullseye. Lesions is with a central clearing, and it is mainly erythema migrans on my top diagnosis, which is we find in Lyme disease. And the differential diagnosis we can keep like erythema marginatum, erythema multiforme, erythema nodosum, and drug reactions. So erythema migrans that is on top. Suppose it is a Lyme disease and erythema migrans, the lesion name. What are the history you ask?
Migrants, I will ask the history about onset, course, and duration, and when exactly did the disease started, and any history of travel, any history of other chronic illnesses, any relation, any long-term conditions, any past medical history, and history of fever, weight loss, activity, sleep, and any other lymph and lymphadenopathy in the body. Um, uh, yes, I would like to examine abdominal examination for
Okay, okay,
hepatitis
history
B.
we complete. I complete the history. So history you tell, okay, because that is on keep in our mind that Lyme disease and other skin lesion we keep. So Lyme disease features we keep in our mind when we take the history. These are like onset, course, and duration. Travel to area of endemic with the insect. So we know that Lyme disease traveling history remain. So travel to area of endemic with the insect. Rash, as rash is here. So rash is itchy, painful, erythema, central pallor, increasing in size. Then fever, fatigue, night sweating. We know that fever, weight, activity, sleep. These are then the features of Lyme disease. Others are like headache, seizure, increased intracranial pressure, neck pain, morning vomiting. Then we know arthritis associated with that, so joint pain or swelling, any muscle pain. And also Lyme disease also associated with heart conditions, so palpitation or chest pain, collapse, eye affection, facial asymmetry, facial nerve affections. Cranial palsy is a features of Lyme disease. So eye affection, facial asymmetry, facial nerve affections, mood changes, recent any travel to endemic area, zoo, park, or hilly area like that we ask. So what examination we do?
Yes, I would like to do complete head-to-toe examination of the patient, including I would like to do for any pallor or jaundice, and also I would like to check for dental hygiene and other kinds of rashes or scratch marks over the body, and abdominal examination for hepatosplenomegaly and lymph node examination and
Okay.
all the vitals I will check.
So as usual, first airway breathing examinations, the vitals, airway breathing circulation, child stable or unstable status. Then there is rash present. So skin examination, skin for rash. I tell you that arthritis is a feature of Lyme disease. So MSK examination for arthritis, heart condition of also carditis present Lyme disease. So CVS examination for carditis, a neurological examination in GCS. We know neurologically child looks to be affected. Cranial nerve examination, special the facial because Bell's palsy, Lyme disease features, and eye examinations. Okay. So what investigation we do? It is a Lyme disease.
Yes, for Lyme disease, I would like to go for serology for Borrelia burgdorferi and a full blood count, ESR, CRP inflammatory markers, and urea electrolytes, LFTs. um, and
Okay.
yeah.
So investigation for Lyme disease, golden standard is clinical diagnosis. From the features, clinical diagnosis and serological test for antibodies ELISA. Okay. Other methods like culture, you tell PCR, it's the viral PCR, clinical susception in the rash, and erythema migrans do ELISA. So mainly there is investigation. It is a clinical diagnosis. We can do the PCR or serological test for the virus ELISA mainly. And for inflammation, you can say full blood count, ESR, inflammatory marker. These are related. And what is the management of Lyme disease?
For management, we have to start the antibiotics, doxycycline for greater than 10 years and ampicillin for less than 10 years.
Yes. It is not 10, actually, it is 9 years. I'm telling you. First, management number one, erythema migrans, non-focal symptoms affecting cranial nerve or peripheral nervous systems. So, if it is not serious, then age more than or equal 9 year, we are giving doxycycline 21 days. Age less than 9 year, we are giving amoxicillin. But it is, serious. It affects the CNS. Then we give the IV, ceftriaxone. Intravenously, we give when the symptoms improve and resolve. If age more than 9 year, we are switch to doxycycline, and total is 21 days. And Lyme disease associated with ectodermatitis chronica atropicans, age more than equal 9 year, doxycycline, age less than 9 year, amoxicillin. Lyme disease with carditis, that is hemodynamically stable, more than equal 9 year, doxycycline 21 days, and hemodynamically unstable, age less than 9 years, ceftriaxone 21 days. So I am telling one thing: the treatment is actually more than 9 year or less than 9 year. More than 9 year, we are giving doxycycline. Less than 9 year, we are giving amoxicillin. 21 days is the duration. But if the child is serious conditions, unstable hemodynamically, CNS involvement, okay, then we are starting with the IV ceftriaxone. And when the patient condition improve or symptoms is going to resolve, then we switch from IV ceftriaxone to more than 9 year, we are giving doxycycline, and less than 9 year, we are giving amoxicillin 21 days. Okay.
Okay, yeah.
Okay. So thank you for your participation. We'll